Good morning, Dr.
Good
Rodriguez.
morning.
Good morning. I thank you for you being part of the teaching. We're learning a lot from you. Would you like to discuss the cases as a doctor you have seen and what changes you've seen with us with the technology, please?
Yes, specifically two cases. The first one, who was the lady who was 38 years old, who had started with breast cancer and then spread the cancer to every single bone, the femurs, the ribs, the spinal, the right brain, all the right side of the brain, the frontal, temporal, occipital, and cerebellum brain. And she came here, and I put her inside the health unit for a month. It's 1 hour, 3 times a day, and with a helmet also. And after 10 days, actually 8 days after we started, she had an MRI, and the tumors from the frontal, temporal, and occipital brain disappeared, all those tumors. And after a month, they're gone. And also after a month, we made a scan, and also all this tumors from every bone was gone, and everything. I mean, she's out of the tumors. We have, after a month, we have the two single tumors on the brain, on the cerebellum brain. It was reduced 80%. So then we started to use, we made a test of GANs. Actually, those GANs are, not GANs, metal on blood. We're waiting for that result just to apply the last treatment to know what kind of metals are involved in these tumors. With either are the zinc or calcium. We're waiting for that, but she's doing great. The second patient is a dog who had a cancer, met cancer on the left leg. He had 2 tumors on the size of the size of a golf ball, and I put it inside the health unit. And in 10 days, one of the tumors was inside the muscles, and the other one was between the skin and the muscle. That one, the second one, disappeared in 10 days completely. The one inside the muscles reduced 80%. Then after a month, we took also a blood test to see what kind of metals was involved, and was iron. So I made a patch of iron in 2 days. Only 2 days afterward, disappeared completely. There's no tumor. That little dog is free of cancer. We were celebrating this today, actually. I saw that little dog, and also just remaining a little pain in the area, but it's doing great. It's full of energy, it's running, and it's incredible. It's beautiful, those 2 cases.
Not only seeing but MRI, I know, I just want to ask you that you make it clear for the public. You see in the blood test changes too, or not?
All the blood tests are normal.
The cancer markers, are they there, or have they changed?
They changed. The cancer markers were reduced significantly, and but still, the lady was waiting for the test for the metals. But everything is doing great. I mean, reducing the tumor markers are too low, and the other test, the liver test, because she had also metastasis in the liver, and she's clean. She's clean of any tumors in the liver. Everything is working perfectly, normal.
You are doing a test on Alzheimer's. Would you like
Yes, I had a patient with Alzheimer. Actually, it was a lady who had cancer for, Alzheimer for many years. In the last 9 months, who was completely out. I mean, just laying on the bed without doing anything, just not be able to communicate with anybody, to walk, anything. They feed him. The lady who was taking care of this patient was using cold pads on the face in order to wake her up and feed her. So I started just using zinc patch, zinc, CO2, and CH3, and I gave them those three patches and asked them to put them on the water container, give them water, and the lady said that it was going to see her in 3 days. So I gave it. I waited for 3 days. In 3 days, the lady's son called me. He was so excited and crying because an hour after she drank the water, she recognized him. He was talking. He called him by his name. He was asking why he's so weak, and she wanted to walk, and she's doing great. And
you gave her GANS water?
Only GANS water. The GANS water, CO2, zinc, and CS3. Actually, patches, not not drink water, just patches.
With the water in it?
The water inside, and put the patches outside the water container. Only that. And you see the response. She's doing great.
You put the patches outside the water container, and she drinks the water from the container.
Correct.
And you've seen the change.
Yes, yeah. She's doing great.
Any other thing you can report us? What do you see as your patients?
Yes, patients with diabetes. We had I had 3 patients who has diabetes with neuropathy, severe. 2 of them severe neuropathy, and I put them on the health unit. 5 days after being inside the unit, they stayed only half hour twice a day because they cannot come more often. And in 5 days, all the neuropathy disappeared in those 2 patients. And blood sugars totally normal in all of them, and it's still coming. They've been coming for 2 weeks, and asked them to come for 3 or 4 weeks to complete this, the whole treatment. They're doing great. Not only just the sugar or the neuropathy, but the state of mind, the
awareness.
The awareness, and they feel incredible good. I mean, just no dramas in the mind. They feel incredible, energized. And
how do you feel as a doctor that you can do this after many years in practice?
We never see those in medicine. It's what we learn in medicine is not this. It's just, we were deceived how to treat people. Actually, we were training to play with the diseases, to make someone else richer, but not to heal anybody. Even though all the doctors, and I know that all the doctors, we have we went to the school to heal people. We have a mind to heal people, to really help, but we were deceived. The medicine that we really learn is not the correct one. I've seen you say that one day. I remember you said the machine, the body, the human body is the easiest machine to handle the universe. And the more I understand, the more I use this technology, it is incredible. I do believe this is so easy to change and to control the body, to change the body, to bring to the balance. And the thing is, what I have learned is not just the health unit, is the plasma. The way I see it, as my experience is a source, is giving us the power to heal ourselves. And that's what we are learning here to be in the unit. We control that plasma. We control the energy. It's not that the plasma is coming in to heal us. It's not that. We feel the plasma. Yes, we feel the energy, but when we think about one part of the body, we send that energy to that part of the body. We control that energy. So it's given us the power that we have inside of us to heal ourselves. This is like I see this is like having a beautiful car without gasoline. Okay, you're the owner of the car, but you don't have a gasoline, you cannot use it. Even though they put a gasoline, there's a plasma. That's it. You are the one who control the car. So you are the one who control this body. And this energy just give you the power to use it to increase your own power and heal yourself. When people are aware of that, they're starting to have better results. Because I've seen people who come in between the unit just thinking in another thing and not focusing on healing. They don't receive much of that energy. But when they focus on the body, they control the energy. They control the
flow of plasma.
The plasma, yes. This is just a source for you to give it to raise the power of yourselves, to give you the power back to you. This is the way I see the plasma, and it's beautiful. I love this, and every time I see more patients the experiences, I love this technology. I love this knowledge and becoming more aware of our own power.
Thank you very much.
No, thank you. Yes.
You're welcome. Would you like to tell us how you dealt with the technology behind how you dealt with the cancer tumor of the dog? Because that was a specific and you did a specific job. It's important we have a lot of doctors listen, that they understand the science. I explained it to you and you followed it. But as a doctor, explain to us how you saw it, how you did it, that we understand more of. Teach us, please.
Please enlighten me how to, I don't understand the question. So,
you know, you reduced the cancer, how you reduced it.
Okay, well.
How you depleted it from its seed, as we call it.
Well, yes. What I've seen, after you notice that when we have a cancer, yes, this technology allows to reduce the cancer, as I see in 80% of the size. But we have to go to the seeds, and most of the cancer, the seeds of those cancers involve some metals. So we have to do some blood tests to see what kind of metals are involved in this cancer. When we find out what kind of metals, we make the GANs out of this metal. We use it and put a patches. I use patches connected with a nano-coated copper. Put them what's one size on the other of the patient, and the rest it's over. It takes, as I said, 2-3 days to make those tumors disappear. So with this technology, that reduce 80%, and then using the patches with the metal, disappear completely. That's because this is the energy of that tumor. It gives you, so it's energized, this kind of metal. So when we use it, disappear. When we use the cans, it's absorb the energy of that seed.
In a way, you've taken the most part away, and using another part of the technology, you take where it's literally like what we call like a pearl. You take the seed away.
Exactly.
And the way the center is not there. I have to explain something very interesting. Dr. Rodriguez listens to everything and he does everything exactly, and he gets the results with it, which is very strange for a doctor. He followed the pattern through the making the coils. He makes everything himself, and he followed making the GANS batch with the iron, as we explained, that you transfer the energy of the material the way it's in the body, and by doing it, he has confirmed one of the biggest mysteries in the plasma technology, which we said. When Dr. Rodriguez told us one is disappeared and the other one is about 20% of, I explained to him what is the seed. There is something holding gravitational field of this tumor, and it's usually heavy metals. And As suggested and I've said in many of the teaching, cancer has a seed of gravitation which pulls a lot of energy. Nobody ever dies of cancer. We die of lack of energy. And then what Dr. Rodriguez followed in making the way I explained, to make the GANs of the, what do you call, you literally grounded the iron, if I'm correct. Am I correct?
Correct, you're correct.
Yeah. And then he made a caustic of it, and he transferred the GANs of it into a patch. And what happens is what we said, transmutation of energy. Because the iron in the center of the cancer is in the gaseous state, is a plasma, now it's in a stronger position because it receives a lot of energy. With Dr. Rodriguez putting 2 iron on patches on either side, the habit of plasma is opposite to the habit of the man. We look at the more power we put in, it'll work. With plasma you have to learn. Now you put 2 weaker patches on this either side. The cancer cell, which carries the iron of a higher order plasma, tries to bring the other 2 to its level that is equal. So it gives all its energy and its configuration pattern energy to the 2 plates. And in a way it empties itself. And there is no iron. That's how the center is called. And when the center is taken away, there is no support for what is attached to it. And that's how the cancer disappears. I've done this for many years, and now we see the first time proof of it.